Hi, I'm Morgan. This is Marco and Lynn, my handler, and we're going to talk about manual restraints. There are 3 kinds of manual restraints. The first is verbal. If your horse is anxious, you can use a soft, soothing voice to kind of calm them down. Or if your horse is not paying attention to you, you can use like a firm hey to get their attention. Another kind is chemical. You can use acepromazine, you can use xylazine or dormocidin to tranquilize them to kind of get them calm for longer procedures. And then there's physical restraints, which we're going to do today. Your most basic kind of physical manual restraints is just a halter and a lead rope, which Lynn has for Marco. You never want to handle a horse without it because it can be dangerous for you or the horse. If you needed something a little bit more than a halter and lead rope, you can use a chain shank. With a chain shank, you are going to go through the side of the halter, and then you're going to wrap it up and over so that it loops once through the halter so it doesn't fall down their face and damage cartilage down here. And then you're going to bring it out the hardware there and then up and clip it up by this piece, up by his cheek. And then just kind of run this back through so that it lays nice and flat. You can lead a horse with this, but you never want to tie a horse with it. This is just to have a little bit more control over the horse. It is a little bit stronger than just your halter and lead rope. Good boy. Okay, the next kind is a lip chain. You put it in through the same way, but instead of twisting it once around the halter, you just bring it straight across and through the hardware. And what you're going to do with this is you're going to lift up the horse's lip and run it underneath their lip and then pull down on the chain. You never want to pull up because the horse can lift their head up higher than you can raise your hand. Good boy. You never want to lead a horse with this or tie a horse with it. This is just used for a distraction for short, quick procedures that you would do on a horse. Good boy. A variation of the lip chain would be a lip twine, which is just twine or some sort of rope. What you would do is you would tie it up here again by this piece by their cheek, and you would run it through their lip, and you would still apply it the same way, bring it out here and be pulling down. But you would just use twine instead of a chain. Next we have a twitch. What you're going to do is you're going to put 4 fingers through this loop and keep your pinky out so that way it doesn't like slide down your hand and it's easier to get off. You're just going to put it through your fingers. You're going to hold this under your arm so you have a good grip on it. You never want to let go of it because then it can swing and hit your horse or your handler. Just going to grab his lip, put the rope over it, and twist it until it's tight and it won't pop off of his lip. Good boy. Just like that. Good boy. And then take it off. Good boy. This is used for, again, quick procedures for a horse. You put it on for the first 3 to 5 minutes. It's a distraction for the horse. At about 5 to 10 minutes, it's analgesia. It kind of gets a numbing effect for the horse and releases endorphins. That kind of makes them happy. And then at about 12 to 15 minutes, it becomes painful and the horse could explode. So you never want to leave it on for long enough that it could cause the horse pain. There are 2 other kinds of twitches. One is called a humane twitch, which kind of looks like a clamp, and it goes over the horse's lip, and then you wrap the string around the end of the clamp, and then you can like clip it to the horse's halter. So that way one person can apply the twitch, and lots of vets like to use it so that they can just do the procedures on their own. Some twitches, instead of a rope, they have a chain on it. Some people like it better because they think it has more of a bite and so it has a better grip on the horse's lip. Next we have a shoulder roll, which is just up here by the horse's shoulder. You grab a loose chunk of skin, grip it in your hand, and kind of roll it towards their ears, and then you kind of lean against them. Good boy. It's easier sometimes if you have a wall or a fence on the other side, so that way the horse can't just continue moving away from you. This is something that you can do for quick things like giving a shot or an injection or something. It just kind of distracts the horse, but you can't do it for very long because it's really hard on your hand. Good boy. And then we have just a leg lift. It's just where you pick up the horse's leg as if you were going to pick out their feet. If you were going to do something like clipping and the horse was very ticklish and kept like moving his foot around, you could pick up their leg to encourage them to keep the other foot down. Horses are always stronger than you, so you can't physically keep them from putting their foot down if they really wanted to. So just something to be aware of. If you were going to do something on their front foot, you would want to pick up the opposite foot. But if you were going to work on their back foot, you would want to pick up the same side of the front foot. You never want to pick up the back foot because they're much stronger in their back legs and they can still kick you and fling you. Good boy. So those are our manual restraints.